Hi and welcome to our Better Health Together video, where we're going to talk just briefly to give you a taster of the new WA Primary Health Alliance strategy. Now, many of you will know we turned 5 not too long ago, and this strategic plan is really building on, two things. Firstly, our relationships with our key stakeholders, but also building on the work we've undertaken in these past 5 years. I have with me Kane, who is our General Manager and Executive Lead on our new strategic plan. Chris's day job is the Lead for Strategy and Engagement in WAFA. So Chris, short, hard question. What are the key themes in our new strategic plan?
Thanks, Leanne. As we all know, whilst we've been developing this strategic plan, we experienced a once-in-a-century public health challenge in COVID-19. This has really had a significant impact on our communities and will take many, many years for us to fully understand and appreciate the impact that we've seen over these recent months. However, despite the ongoing threat of continued waves of infection through COVID in Western Australia, our government, our healthcare organisations, including WA Primary Health Alliance, have really rallied to the cause and partnered in ways that we have never seen previously to really deliver some very good and innovative partnership approaches to dealing with the immediate and future term impacts of COVID.
So you're saying, Chris, there were some unintended benefits from the COVID experience to the degree it strengthened our partnerships, but also made us rethink some of our strategies?
Absolutely. We always had the intent that our strategic plan would have a very strong focus on partnerships. I think that's one of the clear front runners within our strategic plan, how we better establish and leverage partnerships and relationships.
What is this plan, or what is it about this plan that is a milestone in our life as WAFA?
I think the strategic plan very much takes the learnings that we've had over the last 5 years. We've done a lot in the last 5 years. One of the things in this new strategic plan for us, I think, is that it will create a precision around the services that we commission, the partners that we engage with. We will be very, very, very precise in where we commission, the people for whom we commission primary healthcare services, and the ways in which we commission. We will very much be looking at joint planning and how we will have shared accountability with other partners across the health sector to achieve health equity through better access to primary healthcare services.
So our stakeholders therefore can expect greater clarity on not only our direction, but what we're actually going to do and in the locations we're going to do it and with whom.
Yes.
What else do you think that they could expect from this strategic plan that might be a little different to past plans?
I think we have focused very much on 4 key strategic priorities. Now, these have been very well thought out and very well tested and refined through a range of stakeholder consultations with our executive team, with our key stakeholders, for instance, our councils and committees and our member organisations, and ultimately with the WA Primary Health Alliance Board. The amount of focus and the way we've set up the strategic plan to enable us to really implement the priorities and the drivers of success well. We've been very deliberate in the next pieces of work from the strategic plan, development of our strategic roadmap, our operational plan, and our portfolio plans that will actually drive the work that people will see on the ground.
Yes, and that's critically important to an organisation such as ours. Why? The myriad of stakeholders who all have a view that it's their concern that needs to be addressed, and the breadth of activity and reach across the geography. So ensuring that very deliberate implementation is going to be key for us to then deliver the outcomes we're seeking. But thank you very much, Chris. We will have our strategic plan on the website, and we really encourage you to go and have a sneak peek. Bye for now.